So after 15-something candidates and numerous debates, former President Barack Obama has decided to endorse Joe Biden after everyone else have dropped out. Now, is that really endorsement? But I guess looking at it from Obama's point of view, do I really want to endorse this guy?
And by the way, I sit on the stand and it get hot. I got hairy legs that turn blonde in the sun. And the kids used to come up and reach in the pool and rub my leg down so it was straight, and then watch the hair come back up again. They'd look at it. So I learned about roaches. I learned about kids jumping on my lap. And I've loved kids jumping on my lap.
Yeah, maybe it's that, or maybe it's the sexual harassment allegations.
From the highways of America, here's the podcast where we talk politics, a little entertainment, some culture, and this and that, from the road to your ears. This is Trend Chat with your host, Brian Bledsoe.
And welcome to another episode of Trend Chat. I am your host, Brian Bledsoe, and if you want to connect with us, we're on Facebook, Instagram, Twitter, Snapchat, TikTok. It's all the same at Trend Chat 24/7. And if you want to connect with us, also you can check us out on trendchat247.com. Also available on Google Podcasts, Apple Podcasts, iHeartRadio, Spotify, just most popular podcast outlets. So, before I get into anything, let's mention who we have on for this episode. We have Dr. Jonathan Baugh with Remote Health Solutions, and we're going to play an interview with him coming up. So, just want to make sure I put that out there. I've noticed in the past couple of episodes, I get there talking, and next thing I know, I forget to even mention our guests and anything like that. So, there. I got out there. I'm obviously going to mention it again. So, I guess one thing I noticed is with everything that's been going on and being on the road, it's getting... scheduling to put out these podcasts is getting a little bit harder because I'm just like all over the place right now. But that being said, I just got to be more proactive as far as getting the scheduling back on track and just kind of get things together a little bit sooner. I tend to procrastinate just so a lot of times everything's kind of done, spontaneously. But with everything going on now and the times and everything, anyway, also given with me being on the road, guess I should give a bit of an update as far as how it looks from my perspective out here on the road, I guess. And, so I guess to go back as far as how it looks at some of these, retail stores, whether it's Walmart, Target, or whatever. Haven't found not one bottle of sanitizer on the shelf. Let me put it that way. I might have saw it in the back of the truck, but by the time I try to go into the store and see it on the shelf, I haven't seen it on the shelf yet. Ever since this whole pandemic started, or at least when everybody just started buying toilet paper and all that stuff. Toilet paper's back for the most part in most places I've been to, that is at least on the shelf. Some places is almost fully stocked. But when it comes to Lysol, any sort of disinfectant spray, I saw a few disinfectant wipes, not the Lysol brand, just the store brand. But at least I saw some. At least there was some on the shelf, and so I'm starting to see that here and there. But like I said, Hand sanitizer, that is nowhere to be found, at least not at the time when I'm going in. And I'm normally not going in first thing in the morning, because one thing, like I mentioned in previous episodes, is that your best bet is to go first thing in the morning, which is true. Even though I may say I don't see any hand sanitizer on the shelf, what I do see by the time I get there is boxes where the sanitizer used to be. So I know they were there. So, but it's not like they're getting enough supply to restock the whole shelf. They're normally probably getting a couple of boxes. And like I said, if you don't get there first thing in the morning, it's pretty sure it's going to be gone. Because I'm guessing that's where everyone is going as soon as the doors open. And when I think about, like Walmart, because their supercenter, it used to be 24/7, but ever since it's been going on, they close around 8:30 or whatever in some places, or maybe a little bit later. But either way, they close and open now, for the time being. And so a lot of places I've noticed, at least Walmart's, they open at 7. And then they have a set time before from 6 to 7 for just for elderly people to shop, which is, as I mentioned before, that's a great idea. That's great that they are doing that. But so people are waiting at 7, and like I said, I'm guessing they're probably just shooting straight over to the pharmacy aisle, or at least the pharmacy area, and trying to get maybe a couple of bottles of hand sanitizer for the day, and that's it. So anyway, I am noticing that. Now, one thing I noticed too is there's just some towns that are just closed to non-residents and visitors, where I will be on the freeway and see a sign saying this town is closed to non-residents, and it's it's on the on the side of the road. And like there's, I guess in some of these towns where they can have enough police officers to patrol the roads, and so they'll have a police officer at the city limit or wherever town it is, and ask your business. So I'm seeing that in some towns across the country. And being a trucker, they pretty much leave me alone. They don't really ask any questions. One, I'm in a 18-wheeler. You can tell that I'm not just, a visitor or just driving through or just visiting or whatever. They know I'm there for business. I'm not just driving the truck just for leisure. So that being said, we are given a letter that basically states that we are conducting essential business, just in case we come across someone that wants to question why are we on the road, which again I find absurd, because I'm in a semi truck. What do you think I'm doing? I'm just driving around. But I'm pretty sure it probably happens. So that's why we have those letters in our trucks now. So also, President Trump has been talking about reopening the economy. He has unveiled his plan to reopen the economy, which is in 3 phases. And so far, there's a good number of states that are looking to be ready to start phase 1, which I don't know if I mentioned this. I think I did in the last episode, or maybe a couple episodes ago, is that when we reopen the economy, that is not going to be all at once. I don't know if I mentioned that or not. I think I did, but it's going to be gradual. It's going to be in like the president has done. It's going to be in phases. And so when I heard about this, it's not something I was surprised to hear. It sounds like the smart thing to do. But that being said, as much as the president want to talk about opening the economy, I think we need to realize that these Democrats from DC all the way down to the county level, whether it's the governors, and most major cities are run by Democrats, and they wield a lot of power, which we have seen in a number of states and cities. And now that President Trump is talking about reopening the economy, they, meaning Democrats and also their friends in the media as well, are just going to fight whatever plan that the president is implementing or wanting to implement. They're going to try to undermine it at every point that they can. Any way they can make it seem like this is the wrong thing to do, whether they agree with it or not. It's just strictly politics. But I mean, they won't say that. It'll be in the name of public safety, of course. But they're going to try to, either try to say, well, this is too fast, or we shouldn't do it this way. We should do it another way. Anything. And yeah. One, I think a lot of these, especially the Democrats in particular, and there's Republicans that's doing this too, or at least falling subject to it as well, only because they just don't want to be held liable. So if anything, I'm not going to say all, but I would say, well, most of the Democrats, I think, are doing it strictly because this is their ideal scenario to use their power to control people, to have as much control as possible. As far as Republicans go, I'm pretty sure there's some Republicans that are the same, just as much as the Democrats, the rhinos out there. But I also think there are other Republicans who are basically doing this out of fear, because they don't want to be held liable if they are basically going to be accused of not doing enough. If just one person gets sick by doing something different than what the Democrats are doing, which is just basically, totalitarian control. And if they're not doing what those Democrats are doing, and one person gets sick, one person dies, then they're all of a sudden they're like, well, you didn't do enough for your state or for your county or for your city or whatever. And so from that fear, they're going right along with what these Democrats are doing. And, even if they probably don't agree, but they're just scared. Just scared just about as much as people are as far as wanting to give up our freedoms and everything and not even bat an eye when some of this is going on. I mean, we've shown, for one, unfortunately, through 9/11, I've mentioned this before, that, when fear is in play, our freedoms tend to be secondary, especially to at least a good number of people. So whether it's, people out in, up in Michigan and having the governor up there just making it where you can't even buy seeds, and at the same, and in the same sentence almost probably in talking about wanting to ban people from buying seeds, then she want to turn around and say something like abortion is life sustaining, which is just totally absurd. I'm trying to find another word. I already said absurd before, but still, it is just life sustaining. Really, abortion. That's the exact opposite, because you're, with abortion, you are 100% not sustaining one life. So, but, and it's not just there in Michigan. It's across the country. Like I said, most major cities are run by Democrats. And so even though President Trump is talking about opening the economy, you're going to have these governors that are still going to try to keep things locked down. Like I said, in the name of public safety, but just because it's it's an idea from President Trump. Because if this was the other way around, there'd be if this was Obama in office, they'd be trying to open the economy up probably sooner. So, no, they probably wouldn't have shut down at all in a lot of cases. But because it's President Trump, they just want to do anything they can to just to basically undermine him at every step. So anyway, that being said, also this whole pandemic is going on, and I've been talking about this for the past couple of episodes. I mean, over a month. And so luckily we finally have a doctor to talk about all of this and also talk about his company, Remote Health Solutions. So after a word from the Founding Project, we'll hear our interview with Dr. David Baugh.
Hello, Trend Chat listeners. If you like the Founding Project's Civics Education video series, Civics for All Ages, and our educational meme series, we think you will love our new website. Join us at thefoundingproject.com and be a part of the civics movement. The Founding Project is a 501c3 education nonprofit. Please join us today.
Commentary as subtle as a sledgehammer. This is Trend Chat.
Hello, this is Trend Chat, and we are very pleased to have Dr. Jonathan Baugh with us. He is the Chief Medical Officer and co-founder of Remote Health Solutions, a telemedicine company. And we want to bring him on, not only because, to actually have an expert opinion as opposed to hearing me ramble on about all this, and actually hear from a doctor for once. So we're very glad to have him on. So how you doing, Dr. Baugh?
Good. Thanks for having me on. I appreciate it.
So first, let's get really basic before I get into everything about telemedicine. What is COVID-19? So I don't even know what that means. I mean, we're saying it all the time. What does that even mean? That word?
That's an excellent question, because I think there's still a lot of people who are like, well, listen, I hear this phrase all the time. And then I know it's a coronavirus. So really, what is this? And I'd love to educate. So let's talk a little bit about this virus to start with. So this virus is a type of virus that lives in a family that's called a coronavirus family, and they label those based upon the shape. And this particular coronavirus is called the SARS-CoV-2 coronavirus. So that SARS stands for acute respiratory syndrome. The COV, that's the coronavirus, and 2 is it similar to the SARS virus back 17, 18 years ago, more similar to that in structure. What the COVID-19 stands for is that the CO, it's the coronavirus, or the corona, and then the virus, COV, and then the D is for the disease. So it's COVID-19 because it was first discovered in the tail end of 2019 last year. So COVID-19 really has to do with the disease. We have begun to use it universally for the virus itself, but really it's the name of the disease that the coronavirus causes. So COVID-19 has become universally known as for the virus, but really it's the disease. We use it interchangeably at this point.
Okay, so yeah, that sheds a lot of light on all of this, because I knew none of that. Now, I guess let's get even a little more basic, because where does coronavirus come from? Because I know this is not some conspiracy from beer companies to make Corona, devalued.
You are correct. I am almost 100% positive it is not from any beer company. Now, where coronaviruses as a whole, they are in our community. There are several types of coronaviruses that I diagnose as an ER doc quite frequently. They're one of the common cold viruses. Now, the difference with this is a new virus that has not been in the community, that has not been in the human population at all before. We most think that this came from a bat. The way that this works when a new virus goes from an animal to a human is there has to be some mutation in there, and so it changes enough that it can go from an animal to a human. And normally that's where it stops. It stops in this animal to human transmission. That happens sometimes. We obviously don't know how often that happens, but then what happens next is when it can go from a human to human transmission. And that's what really makes some of these significant, like the swine flu, the H1N1, the previous SARS virus and the MERS virus. We believe that this came from a bat, because that's what the previous SARS and MERS did. There is a coronavirus sort of reservoir within certain bat populations. And so whether it's, people have talked about whether this was a bat that was ingested, eaten, or whether this was one that came from, sort of airborne droplet from bat to human, it's a little tough to be able to know right now because there's still so much research. So that's some of the thing about this coronavirus. It's different in structure. The coronavirus is in our community, in human population all the time, but this one's different. And it not only is it different in the fact that it came and now it goes from human to human, but the fact that we don't have any immunity to it is one part of the big problem. And then a couple of other problems is it's very highly transmissible. It's about 3 times as transmissible as most viruses, especially including the influenza virus, and it has a pretty high mortality rate, meaning one, it goes from human to human easy, and 2, it kills fairly effectively. If we look comparatively, influenza, well below 1%, about 0.1% mortality rate, and this SARS-CoV-2 COVID-19 virus has a pretty big spread between about 1.5% and 12% mortality rate, depending upon location and medical accessibility. So, for instance, right now, Italy has about a 12% mortality rate. Spain has just under 10%. Worldwide, we're about 4.5% or 5%, and in the United States, we're about 2%.
Okay. And you have been seeing some of these patients who have coronavirus, correct?
Sure, yeah. So I work in 2 different avenues here, and one is as a practicing ER physician, and the other is as the chief medical officer, co-founder, as you mentioned, of Remote Health Solutions, a telemedicine company. And so we get to see I get to see both sides of this. I get to see live patients, interact with me in an ER setting, and then I get to see remote patients over telemedicine. And we think that we were actually the first company to monitor a patient in this pandemic remotely in their home. Because when we were on the call with the CDC and we were asking if this had been done yet, they hadn't. Nobody else was able to say that they had. So we see patients remotely. We monitor them at home, make sure that they check their vital signs and do well that way. But then also I see patients both under investigation and positive COVID-19 tests as a physician.
Okay. And so with the coronavirus and everything that has been going on the past couple of months with this, I know you mentioned some of this kind of just a few minutes ago, but I guess how would you, as far as different viruses that have been going on, you said that this has a higher, mortality rate and everything. So that would be, I guess, the main factor as far as what makes this so different from other pandemics that we've had.
Yeah, it's sort of 2 things, right? It's that transmissibility rate. It's very highly transmissible from person to person. That's why we're doing the whole stay-at-home, self-quarantine, isolation. And then it's also the mortality rate, like you mentioned. And it's, looking at this pure science-wise, it's pretty impressive in the fact that some of the pandemics that we've seen in the past, or some of the epidemics that never became pandemics, didn't become pandemics, didn't go worldwide because their mortality rate was too high. So, for instance, MERS, which was another coronavirus, it had like a 30% mortality rate, and so it killed many of its victims, and it was pretty fast in doing that. But what's different about this COVID-19 is the fact that it's very highly transmissible. It has a relatively long incubation period, up to 14 days. During that, after about the 2nd or 3rd day, maybe up to the fifth day, it's transmissible. So you may not even have symptoms, and you're able to transmit this virus to another human, and then it has this reasonably high mortality rate. So it doesn't kill its host right away, but it's able to be spread during that time, and then it has a high enough mortality rate to be very significant without killing off all the hosts so they can still spread more. So that's some of the things that makes it different. Why it's gained so much notoriety over the past, a month and a half, really, and over the past about 4 months worldwide.
Now, one of the, I guess, aspects of all this is been told by many people that you can show symptoms between 2 to 14 days. And I think a lot of people, I mentioned before in episodes past about the whole idea of, staying at home and social distancing and everything like that. It's not the fact about getting sick. It's about the fact that you may go on for days or 2 weeks at the most and be spreading it around and not even know it.
No, you're exactly right. That's the whole point of staying at home, is to be able to protect those who have higher rates of mortality or severe symptoms. So about 81%, that's the number that I'm reading most currently. 81% of patients will have mild to no symptoms. So maybe they might feel like they've got a mild cold, or maybe they're just not, they're completely asymptomatic. So that's 81%. And then we're looking at another, let's see, let me remember the numbers. I'm not sitting in front of them. I think it's another 14% that we have severe symptoms, and then we have 5% that are critical symptoms. And then out of that, like we said, we've got about a 2% mortality rate. So yeah, 81% of patients will have mild and no symptoms at all, and then another 14% will have pretty severe symptoms, and then that last 5% are going to have a really critical symptoms, even if they're not, even if they don't succumb to it, even if they don't die. They're very sick. They're in the ICU. They probably will get intubated. Those are the ones that are very sick in the hospital.
Now, for the people who may be asymptomatic, are we going to get to the point where everyone would have to be tested just to make sure you're not just carrying the virus, for however long?
So more testing is better. I always say more data is better. So the more that we can test, then the more that we'll know. And one of the things that we're going to have to start doing is there's a couple of different types of tests. The common test that is out right now is a type of test that sort of measures the presence of the virus in your system. And so that says, do you have the disease right now? And we're going to be moving into a different type of testing that measures antibodies. And so we'll measure IgM and IgG antibodies. And so that's where what you're asking is, that's when that will really, really help, is because we can measure, somebody's asymptomatic, you swab them with the current swab and say, well, you don't have it. You don't know if they don't have it, if they're immune, or if they've already had it. But with an IgG, IgM, and the antibody test, then we can know whether they've had it and recovered, or whether they're newly symptomatic based upon the antibodies.
Okay. So with all of this, and being the chief medical officer and co-founder of Remote Health Solutions, so how is telemedicine? How is that? For people that don't know what telemedicine is, I guess let them know what that is, along with your company.
Sure. Yeah. So classically, telemedicine it's remote patient care. Historically, it first was just that talk to a doctor or a provider over the phone. That's where telemedicine. So that telephonic communication was the first. And then came in the ability to add video, and then video and voice together, think like FaceTime or Skype or something. And now what we've done additionally is add in the ability to gather data, so we can check vital signs, we can listen with a stethoscope, we can get an EKG, we can do all this stuff remotely without ever being in front of the patient, depending upon which device we're using in front of the patient. So, for instance, we have kind of two main arms of our business for Remote Health Solutions. We have a governmental side where we work extensively with governmental agencies and the Department of Defense, the DoD, and we supply devices for them to monitor patients and to connect a patient and a physician remotely. And then on the commercial side, we deal a lot with Medicare and Medicaid patients where we send a small tablet home with a chronically ill patient, somebody who maybe just has high blood pressure or diabetes or congestive heart failure or something like that. And we monitor their vital signs and we respond to those alerts that our device and our platform give us when those vital signs change so that we can improve their outcomes. So those are the two big avenues of what we do. And so it was an easy transition for us to be able to step into taking care of COVID-19 patients, because with our larger devices that are located in hospitals, clinics, FEMA tents, those type of things, that we can gather some more data, we're using those as we set up mobile tents and to be able to connect clinics or rural hospitals with specialists, or to provide some EICU, some tele-ICU services as well. But then also our smaller devices we send home with patients who either are persons under investigation, or they are, or they are diagnosed, but they're mildly symptomatic. They don't have to stay in the hospital. Maybe they're moderately symptomatic, but they're a pretty healthy person. So we can send them home, watch their vital signs, and respond to any alerts. And if they need to come into the hospital to stay there, we have that ability. Or if they just need some more telemedicine intervention, we can do that as well.
And so, I guess, how are you able to do all this remotely? Or what?
So when we enroll patients in home monitoring, then we send them a little packet, and that has a small little tablet in it, kind of things like an iPad mini, with some special software on it. And then in conjunction with that, we send them a little, kind of like a little little bag that has, a blood pressure cuff in it. It has an oxygen saturation, a heart rate monitor, a thermometer, and then sometimes we send a glucometer to check their glucose if they need to, and sometimes we send them a scale if they need that as well. And then what those devices do is they are Bluetooth linked to that little tablet. So then that patient every day is able to step on the scale, and then it forwards to their tablet, or they check their blood pressure and it forwards to their tablet, and then that information goes from the tablet, stays on the tablet, but it also goes up to the cloud, and then that cloud is accessible by our providers, our physicians, our monitoring technicians, and our nurses, and we use a little bit of artificial intelligence, a little AI, that alerts us when those are changing, and that's how we respond. So we gather that data through Bluetooth technology that goes to the device, and the device goes to the cloud, and that cloud responds to us.
Oh, okay. Okay, so, yeah, you mentioned that earlier, and I guess I wasn't putting two and two together about the tablet and all that, because I was still wondering as far as how it all works out, because I was trying to think of it myself, because personally, it's something I've never used or heard of it before. But when I heard of the term telemedicine, I was always thinking about telephone.
Sure.
But now, with technology now, you can be able to do as far as what you're saying now with video and have everything, synced up with Bluetooth and a tablet and all that. And at this time, this is a great resource. I think so, at least. It's a great resource for people, especially if you want to take them to the hospital or the clinic, and it will cut down on a lot of, unnecessary visits. Now, one thing I want to mention before we go is treatments. So are we seeing any treatments? I mean, we're hearing a bunch of different things about treatments that may be, coming or whatnot. In your opinion, are there any real treatments, at least right now?
Yeah, that's a tough question. And the reason why is because we don't have a lot of data yet. But we're gaining that data right now. It's kind of the main treatments right now that are being looked at is this hydroxychloroquine. It's a drug that's been around for about 70 years. We know quite a bit about it. It does have some side effects with QT prolongation. That your heart rhythm has the ability to change that. That's actually fairly rare. It has some opportunities to affect your retina, your eye. That's also fairly rare. That's actually very rare. And then has some issues that can have a little bit of issues with your kidney, which is also very, very rare. And then, so that's probably the main one that people are hearing about right now, hydroxychloroquine. That, in addition to a common antibiotic, azithromycin, and then maybe plus or minus an antiviral as well. That's it's funny. I was just talking to a couple of my ICU friends, pulmonary critical care guys, just this morning, and a couple of them are using it. Well, actually, pretty much everybody's using it right now because it's the best thing that we have. I know one guy told me, one of my buddies said, I don't think I'm seeing any improvement with any of my patients who are on it. Another one said, Justin, I really think that all my patients who are on it are doing better. And then another one said, I'm kind of half and half. I'm not quite sure. And so the spectrum is still across the board as far as whether or not this hydroxychloroquine and azithromycin is effective. There are some known side effects, but it's probably the best thing that we've got. We're just going to do some more studying, and we'll get an answer here pretty quick. The FDA has come out and not cleared it as a treatment, but has sort of freed it up as an option, a known off-label use for it, to be able to say, yeah, this is an option. We've heard some other things out there, what we call convalescent plasma. So those who have had the disease and gotten better, they're taking their plasma and using that as a treatment. That's got a lot of study yet to be able to figure out whether that's actually taking their good antibodies and utilizing that. So that's an additional option. Some additional things that are out there, some antivirals and some antiretrovirals. Those probably have the least. The antiretrovirals like HIV medications, those seem to be the least effective out there. Some of the antivirals, though, like remdesivir, that is maybe effective as well.
Okay, well, I'm not even a doctor, but I would just say, for one thing, people are different. So, as far as the reaction goes for every person, I mean, it just depends. I mean, everyone have different conditions and a whole bunch of different factors that go into it. So, yeah, it's going to take some time. But I understand. I mean, for one, with the economy and everything shut down, we want a fix. We want a quick fix. But I mean, unfortunately, it may take some time, and we just may have to do some, change the way we do things. But hopefully, we'll be able to at least get moving again, at least. So,
I agree.
So, if people want to know more about remote health solutions and want to either, I guess, find you on social media or whatnot, where would it go?
Yeah. So our website is rhsusa.com, Remote Health Solutions USA.com. So rhsusa.com. We've got solutions, we've got answers. We're working across the spectrum, across the nation. We're trying to help. Thank you.
Okay. Dr. Baugh, thank you so much for your time.
Yeah, appreciate it. Have a great day. Be safe.
Hey, everybody. It is Chad Prather, host of the Chad Prather Show. You are listening to Trend Chat with my man, Brian Bledsoe. Come on with it.
And thanks to Dr. Baugh for joining us. Now, I don't know if you noticed in the past couple episodes, I've been able to, to integrate some of these, I guess you would just call them ads, but just wanted to have my, podcast partners, people who are, supportive of the podcast, and I've been able to record, a little bit of that and just play it throughout the music, right? I'm not going to do that in this one only because, basically all of our, supporters, podcast partners, as we call them, are doing something different right now with the whole pandemic going on. And so like TrumpMug.com, they're selling face masks and sanitizer on their site. So TrumpMug.com, which sells all sorts of Trump-centered gear, flags, pins, money, coins, and whatnot, mugs, of course, and all that. So TrumpMug.com, they're also selling face masks now and hand sanitizer. So if you are looking for some, you can check out TrumpMug.com and get either some face masks or sanitizer. And so if you go on TrumpMug.com, you put in the code TrendChat, you get 10% off. So that's TrumpMug.com. TrendChat is the code for 10% off. Also, Culture Life 1972, they're selling masks as well. So COL1972.com. Also there, if you put in the code TrendChat, you get 10% off as well on there. As a pro-life fashion line where you can check them out at COL1972.com. Code TrendChat, get 10% off there if you want to get a mask from them. Also, 1776united.com. They're also selling masks. They're selling kind of like the net gaiters, or they call them who rags. So it's face coverings. That's what they're selling. So they're all doing something as far as wanting to help out with people that maybe need some of these supplies. So 1776united.com. Also put in the code TrendChat, you get 20% off on your first purchase. So yeah, so I want to just put all of those in one because they're all doing something different as far as with for people that want to, try to stay safe out there and try to help people out. So with all of those, the code is TrendChat. So whether you go to TrumpMug.com or COL1972.com or 1776united.com, TrendChat is the code. You get 10% at TrumpMug.com and COL1972.com, and at 1776united.com, it is 20% off. So check them all out. So hopefully that will help, people who are in need of some of those supplies. Now, in talking about all of this and all the social distancing that has been going on, and I'm pretty sure you probably noticed it when you go in, whether it's Home Depot, Lowe's, or any store now where they're having people to even have like stickers on the floor telling you where 6 feet is apart from someone else and all of that. And, it's all, in the name of safety, and it's, have no problem with it. Now, one thing, actually, I kind of hope some of this stuff stays around even after all this is over. Especially like those people, I think we all know those people that really just don't have any, idea or doesn't any care for personal space. They always tend to stand too close to you. like they be all up on you in line. And I hope now, maybe those people actually stand back a little bit more. So I hope that kind of sticks around in some sense. I mean, maybe not the full 6 feet, maybe, but it gives people some space. You ain't got to be all up on them. But yeah, again, I hope everyone got something out of our interview with Dr. Jonathan Baugh, and also again with remote health solutions. Maybe you might want to take advantage of that instead of, heading out, especially if you're in one of these hot spots where, like, New York or wherever that's, that maybe, whatever hot spot that maybe pop up later on. And so instead of going to the clinic, you'll be able to just do it online and, still get treatment and still be seen. So, and I know a lot of places right now are basically having to where everyone has to wear a mask to go into their store or wherever. And, I know for me personally, like, I'm cautious as far as what's going on. And I've shared on social media, like, the mask that I bought last year that I've added some stuff inside to be more of a filter. And I know some out here, which, which is their right. If they don't want to go out with a mask, that's fine fine with me. That's, it's up to them. And, I know for me, I guess I should say this. So I'm cautious and I'm wearing a mask and I don't go out, even after all this kind of, subsides. I still will be a little cautious until we get some sort of widely available treatment or vaccine or whatever like that would fight this. If for instance, if I would, get it. And until that point, I'll be cautious because, as of right now, I'm not really looking to go to either the state convention or the national convention, which I was thinking of going to. At least the state convention, I was definitely thinking about going there. I also had other plans to go to other events, which I'm pretty sure will probably be canceled. Being a Star Wars fan, I was going to go to my first Star Wars celebration later on this year, which I'm pretty sure that's going to get canceled because I noticed Comic-Con was canceled last week, and that was in July, and the Star Wars convention is in August. And as a matter of fact, it's on the same week as the Republican National Convention, which I was going to work out some kind of way. But either way, I'm not looking to go to either one now. So even if they go ahead with it, I'm pretty sure I won't go. And then again, it just depends on what's available at that time. If we've gotten to the point that where we have some sort of treatment or something like that, I might think twice about it and may go. So, but until further notice, I guess right now, I know I'm being cautious for a couple of reasons. One, as we talked about in the interview, you don't know who's asymptomatic. So that's one reason to be, you don't know who out there or maybe spreading the virus and have no clue because they're not showing any symptoms. Another reason is because you have that 2-day to 14-day window, you don't know who may have it and not showing symptoms yet, and still it could be spreading the virus. Who knows? Don't know that percentage of people that maybe are out there. Then there's a third one. You also have people that may have it and don't care. And I think that's a small percentage. I'm not going to say there's a lot of jerks out there that could care less and would do that. But also in that same, I guess, thought process, in that same, category I would put in, you also have people who may be desperate and just can't afford to not go out. Where, like I mentioned a couple episodes ago, about that 80% of people, according to a Forbes article, that 80% of people live paycheck to paycheck. And I know we had the stimulus checks and all that, but that check's going to run out pretty quick. And you have so many people that have been living paycheck to paycheck, and also over 50 to 60 people. That'd be good if it was just 50 to 60, but over 50 to 60% of people have less than $1,000 in savings. So I'm pretty sure in this month, they probably blown through savings by now. And yeah, like I said, they got the stimulus check. And even if they're out of work and still not working right now, then you may have some that are blessed enough, like myself, who are part of an essential business, right? And all of a sudden, if one of those people that are working in these essential businesses, and they are one of the people who are living paycheck to paycheck and don't have much savings, and they come down with these symptoms, or maybe feel it and try to cover it up in the sense of because they're desperate, economically, where they, I can't afford to not do it until I just can't go to work. And in that time, they've been spreading around as well. So for all those reasons, that's why I'm a little, cautious right now. And as far as want to limit where I go, as far as anything, even Walmart, being on the road like I am, I do have to go. And so, but I'm definitely not lounging around in there. I'm just getting my stuff and getting out of there. Just get my water or whatever. So anyway, just wanted to say that, and just wanted to get that out. Now, before we go, I want to give a shout out. Probably should have done this a little bit earlier, but I still want to give a shout out and for everyone that has been, not everyone who has been listening, but I just want to point out to people who are, I guess, the areas that people are listening, put it that way. Because I always talk about as far as I'm just kind of I'm still astonished by the fact of not only people listening here in the United States, right? But then I see like where in the United States and I'm still kind of like, wow, I'm just kind of surprised. And then I'm even more surprised by seeing any percentage that is in another country, other than maybe Canada. But outside of that, if I see like, I've seen Italy, I've seen Germany, I've seen Russia, I've seen a number of international places, and which it just amazes me. And so I've gotten to the point because, for one, this is my show, and well, looks like we need to get to the end of this, but I'm gonna do this, and I should have done this at the beginning. I'm probably start doing this more often. But so, as far as countries go, obviously, United States is 90% as far as the listenership, but there's like 4% in listening in France. Still, because I saw France a couple of times before. So shout out to everyone in France that has been listening. And now I see another country that I haven't seen before, and I want to shout this one out. So if you're listening in Estonia, which is, from what I saw on the map, is close to, I guess, like Germany, Russia area. So whoever you are listening in Russia, well, not Russia. Well, if you are in Russia listening now, shout out. But in Estonia, thanks for listening. In France, as well as the United States. And so, in the United States, I'm going to shout these couple of cities out and I'm out of here. So, Allen, Texas. Okay. I mean, I'm not surprised there. Some of these I'm going to mention. I have an idea of who's listening, because I know someone in these cities. So, like I said, Allen, Texas, Lincoln, Nebraska. I have an idea who's listening there. Maybe it's somebody, maybe it's more than just who I'm thinking. Maybe it's more than that, which is, again, that's, thank you. What I would say. Miami, Florida. Yeah. Appreciate Miami. So, Weatherford, Texas. I have an idea who that is, but if it's more than that, thank you. And thank you for who I think is listening as well. So, and, now the other one, now, it said Estonia. Now it gives the city in Estonia. Now I can't mention this. It starts with a T. It's Tallinn, Estonia. So I don't know if I may be saying that wrong. But yeah, again, Estonia. Thanks for listening. San Jose, California. Appreciate you listening. Salemburg, North Carolina. Appreciate you. Roanoke, Virginia. Appreciate you. Mulberry Grove, Illinois. Appreciate you listening as well. And Middlesburg, Kentucky. I appreciate you listening as well. Now, there's other cities as well, but those are the top 10 cities that are listening. So I appreciate everyone listening. Everyone. I just want to shout those out. And if you want to get yours on, if for me to mention it, trendchat247.com. Listen to you, like, share, subscribe, tell your friends. And until next time, we'll chat with you later.